Hello, this is Travis Taylor, Healthcare Administrator of Voyager Home Healthcare. This is General Orientation, Section 1.
First, we're going to talk about fraud. The federal government's definition of fraud is an intentional deception or misrepresentation. It is knowingly or willingly executing or attempting to execute a scheme to defraud any healthcare benefit program. It is obtaining by any means of false or fraudulent pretenses any money or property of any healthcare benefit program. Fraud is always intentional. The four common themes of fraud include intentional fraud acts, deliberate fraudulent acts, anything that includes concealment, and false statements. The federal government's primary healthcare enforcement tool is the False Claims Act. It prohibits submitting or causing to submit a false or fraudulent claim. A false claim is when a provider intentionally submits a claim for payment that is for services or supplies that were not provided specifically as presented. It prohibits healthcare providers from knowingly presenting or causing to be presented to the federal government a false or fraudulent claim for payment or approval. An individual who violates the False Claims Act must pay a civil penalty of 3 times the amount of government damages and $5,500 to $11,000 per claim in fines. This makes any violation of the False Claims Act extremely costly. Qui tam provisions allows employees and contractors and other whistleblowers to personally bring suits on behalf of the government and to keep a portion of the award. It provides an incentive to whistleblowers, and it is a powerful way for whistleblowers to help the government stop many kinds of fraud. Deficit Reduction Act offers states a financial incentive to adopt the False Claims Act by offering an additional 10% of any funds that are recovered by state Medicaid false claim action. Currently, more than 30 states have enacted some type of False Claim Act. Government recovery efforts. Approximately $7.3 billion in civil settlements and judgments between January 2009 and June 2011. Over the next 10 years, the government predicts that the Department of Justice will recover between $3 to $4 billion annually in civil fraud judgments. The Fraud Enforcement and Recovery Act of 2009. It amended the False Claims Act. Under the False Claims Act, entities and providers that improperly hold overpayments from the government are liable. It broadens the scope of providers' accountability. Organizations can now be held liable if amounts owed to the government, such as those resulting from inadvertent overpayments, are concealed or not refunded to the government. Now let's talk about waste and abuse. Waste is overutilization of services or other practices that directly or indirectly result in unnecessary costs to the healthcare system and taxpayers, including the Medicare and Medicaid programs. It is not generally considered to be caused by criminal, negligent actions, but by the misuse of resources. Waste can be identified with inappropriate actions, mismanagement, and inadequate oversight. Abuse involves payment for services or items when there is no legal justification to that payment. However, abuse involves a home health care company unknowingly and/or intentionally misrepresenting facts to obtain payment. Abuse is not always easily spotted and identified. Some examples of abuse are medically unjustified or unnecessary services, payments for services not meeting recognized standards of care, client bills and payments that are erroneous or incorrect. What is the difference between fraud and abuse? It depends on specific circumstances, acts, prior knowledge, intent, available evidence, along with other factors. Waste and abuse are usually done with good intentions, but can possibly turn into fraudulent acts if they become a habit. Fraud will have a clear evidence that such acts were committed intentionally, knowingly, and willingly. Some examples of fraud are administering or billing for unnecessary medical services, incorrect billing, billing for services multiple times, or billing for services not performed to the client, not following state and federal laws and regulations in terms of providing services to clients who are not homebound or deemed appropriate for home health care. For example, A client meets the regulation standards for discharge from the home health care provider. However, the client is not discharged. Lastly, fraud is the misrepresentation of services. Further examples of fraud, waste, and abuse include illegal remuneration. Prescribers offered paid, solicited, or received unlawful incentives to induce prescriber to write prescriptions for drugs or products. Marketing schemes. Consumers are offered cash payments or other rewards as encouragement to enroll in Medicare, Medicaid, or healthcare benefit plan. Fraudulent billing. Provider submits claim for services not received by health plan member. Government agencies in the enforcement of home healthcare compliance. We will now speak about some notable government agencies that are important to home healthcare companies. First is the FBI. The Federal Bureau of Investigation upholds and implements the criminal laws of the United States. The DOJ, the United States Department of Justice. They enforce the law and defend the interests of the United States according to the law, to ensure public safety against threats. And lastly, the Department of Health and Human Services, the United States government's primary agency for protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. The HHS also has a fraud prevention task force named HEAT. HEAT is the Healthcare Fraud Prevention and Enforcement Action Team. In May of 2009, the Department of Health and Human Services and Department of Justice created the Healthcare Fraud Prevention and Enforcement Action Team. HEAT was created to help fight against Medicare fraud and became a cabinet-level priority. HEAT's missions: to gather resources across the government to help prevent waste, fraud, and abuse in the Medicare and Medicaid programs, to crack down on the people and organizations who abuse the system and cost Americans billions of dollars every year, to reduce healthcare costs and improve quality of care by preventing fraudsters from preying on people with Medicare and Medicaid, to highlight best practices by providers and organizations dedicated to ending waste, fraud, and abuse in Medicare, to build upon the existing partnership between HHS and the Department of Justice to reduce fraud and recover taxpayer dollars. Next up, I will speak about CMS. CMS is the Center for Medicare and Medicaid Services. It is an agency responsible for organizing several key federal healthcare programs within the U.S. Department of Health and Human Services. In addition to Medicare, the federal health insurance programs for seniors, and Medicaid, the Federal Needs-Based Program, CMS, oversees the Children's Health Insurance Program, the Health Insurance Portability and Accountability Act. The three types of parties are the first tier, which any party that enters into a written agreement with a Medicare health plan or contract applicant to provide administrative services or healthcare services to a Medicare eligible individual. Downstream, any party that enters into an acceptable written agreement below the level of arrangement between a Medicare health plan and contract applicant and a first-tier entity. These written arrangements continue down to the level of the ultimate provider of health and/or administrative services. Related, any party that is related to the Medicare health plan by common ownership or control and performs some of the health plan's management functions under contract or delegation. 2. Furnishes services to Medicare enrollees under an oral or written agreement. Or 3. Leases real property or sells materials to the health plan at a cost of more than $2,500 during a contract period. Now let's discuss the Anti-Kickback Statute and Stark Law. The Anti-Kickback Statute makes it a criminal offense for a provider to give remuneration to a physician in order to compensate the physician for past referrals or to induce future referrals of patients to the provider. It applies even if just one purpose of the remuneration offered, paid or received, is in exchange for referrals or to produce referrals. What is remuneration? Something given in exchange for goods and services. Can be anything of value, directly or indirectly, overtly or costly, in cash or in kind. The Stark Law restricts physicians from creating referrals for certain designated health services to providers which the physician has a financial relationship unless the relationship meets an exception under the law. If a physician is paid for services to your home health agency, the physician now has financial relationship with your agency. Congress created several exceptions to these rules since they realized the anti-kickback statute and Stark Law were too broad. Relationships allowed under the rules are known as safe harbors for the anti-kickback statute and exceptions for the Stark Law. Another important topic to go over is conflict of interest. It happens when an employee or contractor influences or makes a decision resulting in a personal gain for an employee, contractor, relative, or another person with whom the employee or contractor has a relationship with. Examples of conflicts of interest are soliciting or accepting gifts or referrals from any company seeking to do business. Our company policy has adopted detailed procedures to detect and prevent fraud, waste, and abuse. All employees will receive a copy of this policy. Failure to comply with Voyager's policies and procedures, which includes compliance with federal and state laws, will result in disciplinary action. What should you do if you suspect any wrongdoing? Report it to a supervisor. Disclosing these concerns to management is required. What are the rules for protecting patient privacy? HIPAA and HITECH dictate the privacy of patient information and the reporting of privacy breaches. HIPAA includes the Privacy and Security Rule. The Privacy Rule provides federal protections for individually identifiable health information held by covered entities and their business associates and gives patients an array of rights with respect to that information. At the same time, the Privacy Rule is balanced so that it permits the disclosure of health information needed for patient care and other important purposes. The Security Rule. It is a series of administrative, physical, and technical safeguards for covered entities and their business associates to use to assure the confidentiality, integrity, and availability of electronic protected health information. HIPAA and the associated security and privacy rules collectively set the national standard. HITECH is part of the American Recovery and Reinvestment Act that was enacted on February 17, 2009. It requires healthcare providers to promptly identify, report, and resolve privacy breaches of patient health information. It expanded on the penalties imposed for violations of the privacy rules and regulations. Privacy standards were developed to give patients more control over the release and use of information by healthcare entities. The patient is the only person who determines who will see or obtain this information. Protected health information includes patient name, dates related to the patient or service, birth date, admission or discharge date, social security number, and medical records or health plan number. Voyager Home Healthcare has a legal and ethical responsibility to safeguard the privacy of protected health information by protecting and limiting the use and disclosure of patient information. When using protected health information, use the minimum amount of information needed. Only the individuals who need to know the medical information should get access to patient information. We only disclose protected health information when it is directly relevant to the person's involvement in the patient's care or the payment for the care. All requests for the release of information are reviewed. For example, how do you ensure that you're talking to the right person before disclosing information? First, ask for the patient's name or account number. Second, verify either the date of birth, phone number, or address. The exception to the rules regarding disclosure and authorization include treatment, payment, and operation, also known as TPO. The only time company employees may share protected health information without the patient's authorization are for the reasons that fall under TPO. Treatment refers to services provided by one or more healthcare providers. Payments refer to activities such as billing and reimbursement for services. Operation refers to certain administrative, financial, legal, and quality improvement activities that are necessary to operate the healthcare entity. HITECH requires Voyager Home Healthcare and its staff to promptly identify and report any breach of the patient's protected health information to management. A breach is defined as the unauthorized acquisition, access, use, or disclosure of unsecured protected health information which compromises the security or privacy of such information. This includes electronic, verbal, or paper breaches. Privacy breaches or violations include discussing patients with your friends or family or with other patients or families, inadvertently sending an email to the incorrect person, disclosing more information than necessary, sharing information about patients or families on social networking sites, mailing or faxing physician orders or bills to the incorrect person, taking pictures of patients on personal cameras or cell phones. Violations of the privacy and security rules carry both civil and criminal penalties. Civil penalties include 4 tiers. Tier A is when the offender didn't realize he or she violated the act and would have handled the matter differently if he or she had. The result is a $100 fine for each violation. Tiers B, C, and D are violations due to reasonable cause, willful neglect that organization ultimately corrected, and willful neglect that the organization did not correct. The result is a $50,000 fine for each violation. Criminal penalties transpire when any person who knowingly receives or discloses individually identifiable health information in violation of the privacy rule may face a criminal penalty of up to $250,000 and 10 years imprisonment. There are some ways to protect privacy. When in doubt, don't give information out. You may only disclose personal health information without the patient's authorization for TPO only. Verify the identity of the caller. Lock your computer. Assess the minimum amount of information necessary to do your job. Do not leave protected health information unattended on your desk and remove it at the end of the day. Remove papers from copiers as soon as they print. Use a cover sheet when sending a fax and double check the number. Conceal protected health information when taking it home. Lock filing cabinets that contain protected health information. Follow company policies and procedures to dispose of protected health information. Protecting patient health information is your responsibility. To conclude, I will review OCR and OIG. OCR is the Office of Civil Rights. The OCR reports to the President, Secretary of Education, and the Congress. The OCR focuses on protecting civil rights and advancing equality for all. It ensures equal access to health care through vigorous enforcement of civil rights. OCR enforces laws and prohibits discrimination based on sex, race, national origin, disability, and age. Health Insurance Portability and Accountability Act, also called HIPAA, is a privacy rule that protects American civil rights. Federal civil rights laws and HIPAA together protect your fundamental rights of non-discrimination and health information privacy. Federal civil rights help to protect you from unfair treatment or discrimination because of your race, color, national origin, disability, age, sex, gender, or religion. Federal laws also provide conscience protections for healthcare providers. OIG is the Office of the Inspector General. Under the Inspector General Act of 1978, and as amended, OIG is authorized to carry out both investigations and audits to promote economy, efficiency, and effectiveness in the administration of and prevent and detect fraud and abuse in the department's programs and operations. That's a direct quote from them. Through its investigative and audit findings and recommendations, OIG helps protect and strengthen departmental programs and operations. As part of their mission, they conduct investigations that involve employees, management officials, and affected department programs and operations. OIG investigations can include criminal, civil, and administrative matters.